Alhamdulillah, wa salatu wa salam ala rasulillahi amma ba'd. Before we start the presentation, I just wanted to um, give you a little bit of a personal perspective. My presentation will be a little bit different. I do want to talk about some of the scientific aspects and some of the medical aspects, but I want to start by prefacing all of this by telling you something about when I was in medical school, actually when I was in residency, that was when my daughter was born. And you learn things, when you're learning things in textbooks and when you're learning them kind of in a clinical sense, it changes everything when you have to live with it every single day. And so I learned so much pediatrics when I had children. When I became a father, then all of a sudden all this stuff was not just something I saw in the clinic, it wasn't just a 15-minute visit, it was something I came home to and had to deal with for hours on end. So I found myself giving a lot of advice in the clinic and then coming home and saying, this doesn't work. I'm telling people things that are just not reasonable. And so, subhanAllah, things change quite a bit. A lot of the perspectives that I have on autism are from that very reason. Those of you that know me very personally, I've met my family, you know that I have my son, Amin. He's autistic, he's here with us today. Everything I've learned about autism has been passed through that filter, the filter of living with my son who deals with it on a daily basis. So things change a lot when you have to deal with it on a personal basis, subhanAllah. No matter how scientific you are, no matter how academic you are, all of a sudden things change and you find yourself acting very, very human, subhanAllah. So I think a lot of that's going to pass through, in this presentation, I hope. When Dr. McDonough was giving that slide with all the pictures with the different behaviors, it was crazy for me because I'm like, he does all those things. We've been through all that. You know, it's kind of crazy. Secondly, I do want to say that one of the things, the most beautiful things that I've benefited from by living with my son and having the chance to have this wonderful experience of having a child with autism, it is truly, for me, I see it, and I know his mother as well, we see it as a blessing. We don't see it as anything else. We see a way that Allah has created, human beings, and they think differently, but they're still human, and they're still lovable, and they still care, and they still have so much good in them. And so I want that we recognize that as well, is that we're not dealing with, we're not dealing with a leper. We're not dealing, with cancer. We're dealing with something that these are still children, and at the end of the day, they still want to go out and have a good time and play and have fun and stay up late and eat sugar and do all the things that a lot of other kids do. And so sometimes we lose sight of the fact that they're kids, and sometimes when we just kind of relax and let them be, it can change a lot. To talk about autism, I have a lot of different. I found myself kind of struggling because I had to talk about several different things. I wanted to give you part of a medical perspective. I also wanted to give you some talk about some of the treatments that we've actually physically, personally experienced in my family, the successes and the failures. We also need to talk about the Islamic aspect of that because this is something that's totally untouched in the literature today. There's a lot of families dealing with it, but a lot of people don't know how to look at it from an Islamic perspective. And lastly, and very importantly, we need to also talk about how this affects us as a community, because there's a lot of detail that we need to consider and a lot of problems that are happening right now in the greater Muslim community and the greater human community as well. So some of the objectives I want to cover, exploring the important preventable theories, and I put it in different color because just as the previous speakers had said, there's a lot of different ideas out there. We also want to talk about the different research therapies. I'm going to talk a little bit more about behavioral analysis from a different perspective. I was really happy that Dr. Samuel, she kind of gave us that great presentation and took a lot of burden off of my back so I don't have to go through the academic trials and the anxiety and grief they can sometimes bring on and against societal issues. So first of all, nature and nurture. We kind of touched on this already. It's very important to understand when we're dealing with any type of condition, there is a genetic code. We have genes, and we have so much information programmed on those genes. And yet, a lot of those genes are not going to become activated. They're not going to show up in our lifetime until we get involved in a certain environmental condition which will activate that gene. So this kind of theory exists quite a bit in cancer. We understand this a lot with cancer. There's certain people have a gene for cancer, but they'll never develop that cancer until they get into a particular environment. And so this is what we call nature versus nurture, or nature and nurture going together, is that they have to work together. And so it's very important to recognize that there is going to be an environmental component to autism, and that's something we should keep our minds open to. We did talk about that already a little bit. And so a lot of experts are suspecting that environmental factors as well as genetics combine to cause autism. And the second point we want to talk about, this is again from a very medical perspective, and something that I've experienced as a doctor looking at different autistic children, and as a parent seeing autistic children and some of the schoolmates that my son goes to school with. Autism is very different, and I think that I think that in the future autism is going to be broken up into a lot of subgroups. And I think it's one of the things that creates such a confusion with the research, because you'll take a certain treatment and you'll apply it to a group, and 10 of them will get better. 10 out of 100 will get better, the other ones won't. And you wonder, why did these 10 get so much better and these other ones didn't get any benefit? Then you apply another treatment to that same 100, those first 10 don't change at all. They don't get any better than but some other group gets better. So what we're realizing is that we got this big umbrella diagnosis, we call it autism, but I think under autism there's a lot of different subgroups, and that is why the research is so confusing. That's why certain things work with certain kids and they won't do anything for another child. And that's important to recognize. Why? Because we don't want to lose hope. So if you try a therapy, if you're dealing with an autistic child, if you're dealing with an autistic child in the community, or you have a family member that has an autistic child, you have to recognize that sometimes you need to keep on going. Don't lose hope. Don't try 1, 2, 3 and say, boy, these didn't work. I think it's hopeless. We should just, we need to be practical. I've heard people say this to me. In fact, somebody in my community in Orlando, he came up, he wanted to talk to me. He said he has an autistic child who's 21 years old. And he said, we need to sit and talk because, one of these days your kid's going to grow up and he's going to need to be in a home. He's going to need to be in a group home. You're going to need to set up a service where you're going to have to just kind of let him go and let him be institutionalized, essentially. So we need to set up a home for our kids for the future. And I said, no. I said, I still believe that there's plenty of hope out there, and my son is getting better. He's every day, every month, there's improvements. I have not given up hope on that. And so one of the things that causes people to give up hope is because they try a few different things and they don't get the results, and they have not realized, well, hey, maybe you didn't get all the way through it. So experts also agree that finding ways to distinguish between autistic subgroups is going to make the research better, as well as help us to maybe find a cure. Yes, sister? Okay. A growing epidemic. I want to add on this because I don't think we can emphasize this enough. I know it's already been presented, but we need to recognize how big of a problem this is. This is really an epidemic right now. 2001, the Journal of the American Medical Association published a study from the California Department of Health that said the incidence of children with autistic spectrum disorder, ASD, increased 373% in these 14 years. 373% increase. And yes, there are people out there, a lot of them are doctors that say this, a lot of medical doctors that say, well, we're just getting better at diagnosing it. But that can only probably explain maybe 20% of that. Okay, 20% of that number. It doesn't explain everything else. Something else is going on. Something else is going. People, when you go out in society today, there is just way more autism than what used to be there 20 years ago. A lot of people, when we talk about people that went to school back when I was going through high school, going through middle school in the 80s or something like that, early 90s, we did not see these numbers. They did not exist. And now it's just an explosion. I look at just even my medical practice. I mean, when I started medicine, compared to now, I've only been in medicine 10 years. There's an obvious difference for me. We're seeing way more of this, and so there's something going on, and we need to be aware of that. And sometimes when we take that attitude of, well, we're just better at diagnosing, sometimes what happens is that it causes us to again get lackadaisical with regard to looking for a cause, looking for a cure. In 2007, the Center for Disease Control published 2 studies that put the rate among 8-year-olds at 1 in 150. That was in 2007. The most recent statistics of 2010 say 1 in 100, and some of them are actually postulating now 1 in 90. Okay? So you think about your masjid, your Islamic community right now. If you have 1,000 people in that masjid, it's 1 in 100 that 10 autistic children in that community. It's not, it used to be 1 in 1,000, something like that. It was rare, but now we're seeing it all the time. Comparing the CDC's data with California, autism incidence rates increased 1,422% in these 22 years. That's explosive, and that's a concern. And again, it affects us as a Muslim community. It's also affecting us as a country. It affects us as a globe, on the global sense as well. So some of the different causes, this is something we're going to talk about right now, phthalates. And again, I'm not putting it up here because I'm telling you this is the cause. I'm trying to make you aware of things that maybe you had never heard about before. Because more information is not going to hurt you when it comes to this, especially for those that are parents. So phthalates, you can see here, this is Johnson's & Johnson's baby shampoo or baby kind of like the stuff you wash your kids with in the bathtub, okay? And you look at all these things, this fragrance, methylparaben, ethylparaben, propylparaben, all these things, get this stuff out. This stuff is concerning, okay? So you want to start looking at labels, and I never used to look at labels, okay? And all of a sudden I became an expert on looking at labels. Fragrances, okay, perfumes, they have these phthalates in them as well. The most concerning thing for me is this right here, toys. Children's toys. You can see this isn't the toys for the 8 to 10-year-old group. These are toys for the 3-month-old to the 12-month-old group. So phthalates. Children who live in homes with vinyl floors which can emit these chemicals, okay, were found to be more likely to have autism according to a 2009 study in Sweden. They found that the people that had vinyl flooring in their homes were twice as likely to have autistic children. Again, could it be coincidental? Absolutely, it could be coincidental, but we don't want to take a chance because this is a real issue. If you're aware of it, you can look for it. So phthalates, basically what happens is you have PVC. Everybody knows what PVC pipe is, okay? It's those hard pipes, okay? They're real, you tap on them, they're very tough. So what happens is when they wanted to make toys with they're using PVC and they want to make toys with it, they're too hard. Children like something that's soft, and so they put this phthalate on it, and it's essentially it doesn't even attach to it. It's just a layer that sits on top of the hard plastic to make it soft. So this works out great for toys. And so these things have, as Dr. McDonough was saying earlier, been connected to allergies and asthma. And this is, for me, another issue. Looking at children today, I work in the emergency room and I see kids come in. Almost every child I see, I'm not joking with you, almost every single child I see has allergies. I can see it under their eyes. We call it the allergic shiner. When you get a shiner, someone punches you in the eye, get a black eye, that's a shiner. So we call it the allergic shiner because all these kids they look like they got makeup on. They got, this purple line under here. So where is this coming from? You look in their eyes, it's totally red. It's irritated from the inside. They all got runny noses constantly. Again, think about it. For those people who are old enough to remember, you go back 50 years ago, nobody had allergies. People used to go out and play and stay outside all day. No, kids can't do that anymore. They go outside and they get sick. What's going on? What's causing this problem? So we have to think about this, again, as a society. So we talked about the vinyl here. And the study was not a small study. It's very important we look at these studies to make sure that they've got good controls on them, and secondly, that they're not small. Some of these studies, like you look at 30 kids. That's not going to tell you anything. This study looked at almost 5,000 children. Again, with phthalates, one peer-reviewed study published 2010, Environmental Health Perspectives, also talked about this. And the researchers measured levels of phthalates in the urine of pregnant women. So among women with higher levels of phthalates, and again, fragrances, shampoos, cosmetics, their children years later were more likely to display disruptive behavior, which is typical of autism, or ADHD, which is another thing that, kind of exploding. So the question is, with these kids, were they exposed before birth? Did something happen to their nervous system before they were even born? Did we damage their nervous system? Did we, basically hurt them and give them that disadvantage even before they were born? These are important questions that are being asked today. Environmental pollution. This stuff is absolutely shocking, okay? And again, I'm telling you this because I think everybody in this room needs to be aware of it. Whether you have a child with autism or not, whether you know somebody or not, this is going to affect you and your family at one point or another somehow. Forthcoming issue of peer-reviewed medical journal, Current Opinion in Pediatrics, cites historically important proof of concept studies that specifically link autism to environmental exposures experienced prenatally. Environmental exposures experienced prenatally, okay? So these are things that the pregnant woman is outside being exposed to garbage, this pollution, okay, air pollution, water pollution, and so forth, before they even give birth to the child, that